Hello, and welcome to the Minnesota Health Action Group's Case Study Live podcast. I'm Deb Krause, Vice President with the Action Group, and this is August 2020. I hope this finds you and your loved ones safe and healthy. At the Action Group, we know that employers appreciate learning from others. It's always helpful to hear firsthand experiences about what works and doesn't work, and how you are meeting the challenge of helping all employees to be their best selves physically and mentally in your respective organizations. Before COVID-19, we always gathered and shared these stories and lessons in person at meetings and events, but now we're operating in a more virtual world. So I hope you enjoy this podcast series. This case study today was actually chosen in an online competition. So the employers and others who attended our 2020 Annual Employer Leadership Summit voted on the podcast that they wanted to hear. And this one from Magellan Health focuses on mental health and well-being, and also a particular insight in communicating effectively about these programs. Today's podcast features Magellan Health and Ann Robertson, who will be sharing with us her experience. So thanks and welcome, Ann.
Thank you. Thank you so much for inviting me.
A special thanks today because I know you are coming to me from North Carolina, recording this podcast amid Hurricane Isaias. So you're incredibly resilient, and we're grateful for your time today. Let's start off,
Sure.
if you could, give us a little background on both Magellan and a high-level description of the client that you'll be talking about today.
Sure, absolutely. Well, Magellan Health is a leader in managing some of the fastest growing and most complex areas of health, including specialized population. We also have full pharmacy benefits and other specialty areas of healthcare as part of our operations. And really Magellan looks to support innovative ways to better access healthcare through technology, focusing on the complete person approach that's so critical in personal relationships, which are necessary for a healthy and vibrant life. We provide what I think is a proven comprehensive solution for employers of all sizes, with over 50 years of experience in employee assistance programs, or EAPs. We serve national and global customers of all sizes, with very diversified workforces in, a variety of different industries like retail and manufacturing, professional service organizations, and financial services. And that's really more or less a summary of who Magellan Health is. Today, for our discussion, our premier client of focus is one of the largest national home improvement companies. They've got over 1,800 stores in the United States and 270,000 full and part-time employees. And of course, as an organization, as a national home improvement company, they offer, a range of maintenance and repair and remodeling and decorating products for consumers like ourselves and for service professionals. And I would say, they're pretty committed to creating a supportive and inspiring type culture for their associates, and they offer their associates pretty exceptional benefits and wellness programs, and some other things like learning and development opportunities so that associates can help, or have help in supporting their career goals. We provide this customer with a very customized and branded employee assistance program. It's called CALM, and that program includes in-person and virtual counseling, coaching services, support for caregivers, legal and financial coaching assistance.
Perfect. Thanks for that. Can you help us understand a little bit better the key challenges that were addressed by this partnership, and what results were you able to deliver? What could you accomplish together?
Sure. Our client wanted to raise awareness and increase the engagement in their employee assistance program. And so we focused on promoting their newly launched virtual counseling and messaging therapy services. And like, many organizations, but even more so retail businesses, they faced several communication challenges with their associates. So many of them don't have access to computers, They don't have access to laptops or sometimes even the internet at home. They've got frequently changing shifts in their stores, and they operate large call centers, 24 hours, 7 days a week, as well as distribution supply chain centers. So people who are not sitting in a cubicle looking at their laptop or their computer for for any of their services. This associate population is predominantly male, and the vast majority of whom are typically known to be a little bit more reluctant to ask for help with, everyday life and emotional well-being issues. And then, unfortunately, stigma still exists in our country when it comes to seeking assistance for mental health issues and challenges. So one of the things that we did was, in collaboration with this client, we developed communication with conversational language that really simplified and normalized the conversations about mental health. We printed flyers and posted them in their mobile health screening units, which operate by traveling to all the different store locations, and they actually do all the biometric screenings for the associates. We also posted those flyers in staff break rooms and corporate facilities. And the key was that the client decided to send a company-wide email promoting the virtual counseling and messaging services. Within 1 week following the launch of that communications plan, the results were positive. And when I say positive, I say there was a 7,000% increase in the users of the new messaging mobile therapy app.
Wow, 7,000%. You definitely can't argue with that. Those are measurable results. Congratulations. So let's dig a little bit deeper. I'm wondering if you can tell me more, sort of, what did they actually do, key activities, milestones, what made this possible?
Absolutely. Well, critical in working with any of our customers is listening. So we started by listening to our customers' needs and really trying to gain a deep understanding of, how communications are used and work best within their organization. From there, we really knew we needed to develop a plan that reached all associates in the most cost-effective ways. So that's why we were able to pretty quickly roll out ideas like doing a home mailing or a postcard or something like that, because that's fairly cost prohibitive. We knew that multiple communication touch points were important to reach associates. So in this case, we knew we needed to combine the widely distributed email and flyers and couple it with flyers displayed in those mobile health screening units where associates were scheduled for their biometric screening health appointments. And we knew all of that was incredibly important. And we always encourage our customers to develop an integrated communication strategy to ensure that the messages are received by the audience when and where they're needed. So it's not only important to talk about the service offering, when it's introduced, but to regularly remind associates about it. In the end, our client made the decision to continue that momentum with regularly scheduled communications in order to promote these services. And they were really happy with the success of the campaign, and offered a quote indicating, direct and specific communications were the key to making all of this successful.
Perfect. Thanks for sharing that. I really appreciated your comments on listening to the client and understanding the needs, the multiple touch points and channels, the sustained communications, and certainly the integrated nature. Those are good lessons, but it sounds like you really optimized those as you employed it. Here's a few more questions as we just seek to understand this. First of all, I'm curious, why did you highlight this relationship, and what makes this partnership special?
Yeah, well, this organization is one of our marquee employer customers, and they've truly been a partner since 2007 with Magellan to support, their associates and their family members in the area of emotional well-being and mental health and substance abuse issues. They have a really large ecosystem of healthcare benefits and services for their population. And we've been able to together find unique ways to engage their associates and family members, both directly and indirectly, by partnering with many of their other vendors. This customer, really works from the stance of wanting to be cutting edge and innovative in terms of offering new solutions for their healthcare benefits. They're interested in trying new approaches with us, working with us to deliver pilot programs when they're considering new products and services. And they really value what we do as an organization clinically and rely on our expertise for all of their associates and family members.
Perfect. That's really interesting. So I'm wondering, what's one important but perhaps not so obvious lesson learned from this case study?
Yeah, while the communications were really effective and we were really excited about the increase in usage, we did find that we can improve the messaging by providing concrete examples of how the services can be used. For example, saying, messaging therapy can help you in many ways, including dealing with stress, anxiety, or grief, improving your relationship, and more. Listing out a variety of situations that can really resonate with different people and make them pay much more close attention to our message. So that, I would say, is probably one of the most important lessons learned, from this particular case study.
Great takeaway for our listeners. Beyond this case study, I'd love to have you just wrap up by giving us a preview of what's on the horizon for Magellan and what you're excited about for the future.
Yeah, Magellan Health is continuously looking for new ways, to deliver and innovate, deliver value and innovate for our clients and the members that we serve, especially through the means of technology, since it is such a predominant way of reaching individuals. We do have several new products in development that will help working families improve the quality of their lives. And our goal is really to simplify the means of access to mental health and substance abuse care. When we look back over 2020, in response to COVID-19, one of the things that we did was expand our virtual therapy option beyond just messaging therapy. We've done this for all of our clients, including this large retail client. It now includes scheduled live chat, scheduled video, and scheduled phone calls with our counselors. So, this is one way that, while it's a preview of more to come, we looked at this enhanced offering as our ability to continue to support, the mental health and emotional well-being of all of our members by, again, reaching them with the help that they need when and where they need it.
Excellent. Thanks for sharing that. And thank you so much for joining me. It was wonderful to talk with you today, Anne.
Thank you so much. Glad to have been part of this.
As you know, most employers offer EAP services to their employees, but often they're underutilized, and the employees and their families don't get the help and the value that would be envisioned. So it's great to hear how you've expanded your offerings to include more virtual, and how working with this premier client, you were really able to get effective communications out that drove increased utilization and hopefully, as you said, simplified access, reduced stigma, and helped people to get better. So thanks for sharing all of that with me today, especially amid COVID-19 and the hurricane. And finally, thanks to our listeners. Thanks for joining us today. I hope you enjoyed this conversation and found it insightful. This and other case studies from Action Group supporters and Minnesota employers are available on our website at mnhealthactiongroup.org. You can also subscribe to our podcast series on YouTube. Thanks so much. Take care and be well.